Medical practices are struggling, but here's some questions that we answer on a daily basis that can help you as well. As a digital health entrepreneur, we went into medical practice owners, nurse practitioners, doctors, clinic owners all the time and helping them grow their medical practice or clinic. We get a lot of questions and I want to go through these multiple ones. A lot of these practice owners have thousands of patients that they work with, and this is something that can get you through the hump on understanding how you can grow your medical practice. Physician, nurse practitioner, just healthcare professional burnout. How do I handle burnout as a practitioner? I don't have enough to give to my patients anymore because I'm tired. This is a common problem affecting the medical industry right now. As we all know, pandemic that happened 4 years ago, we're still seeing problems from that. One of the big things has been physician burnout. They were burnt out when they had to deal with patients longer periods of time, dealt with issues with patients unfortunately passing prematurely due to this pandemic. They also had to deal with longer hours and dealing with new workflows and technology that was very frustrating at first to kind of maneuver. Now, 4 years removed, a lot of practitioners are just tired, burnt out, right? It doesn't seem like we've gotten over that. Add to that mixed is a lot of changes in the regulations, right? Understanding how to deal with rule changes. First, we had the public health emergency, so rules relaxed. Then last year, those public health emergency rules disappeared. So how do we handle all that? And one of the things that we've seen is that a lot of physicians are looking to get out, especially older physicians, and newer physicians may not want to work for themselves anymore. They rather work for as an employee, but then the job satisfaction is still low. So how do you handle all these different situations when it comes to physician burnout? One of the things that we've seen that's been helpful is physicians need to realize they need what they call a COO, a Chief Operating Officer. If you have a practice, yes, that could be your practice admin, but the practice admin should handle all the operational processes for you. If they're not, then that's not the right person for you. You want to make sure that your practice admin is ensuring front office, back office, interviewing, invoicing is done properly, making sure they handle and work with all the staff, but also vendors that come in to help you grow your medical practice. One thing we've seen time and time again, a lot of physicians, while healthcare professionals in generally are highly intelligent and can learn just about anything, you can't do everything. You are good at taking care of patients, understanding diagnoses, troubleshooting, but more importantly, having the vision of where you see your medical practice going. If you've always had the dream of helping underserved communities, then that should be your vision and how you can grow that. If you have a vision of being high marks when it comes to clinical studies, then you need to stay true to that vision while focusing in on the practice of medicine. But you can't also run it at the same time. So that means having people coming in, whether it's at your practice admin or hiring outside consultants that can help you get you to the next level. Because ultimately, you want to do things that give you energy. If you don't do the things that give you energy, then you will fail time and time again. I've seen it over and over again where medical practice owners who actually are doctors or nurse practitioners are trying to do too many things. They're getting way too into the weeds of trying to figure all this out. I actually had a story of a practice owner who was trying to not only run his practice as a cardiologist, which is highly specialized, but he was also trying to build a business and try to do a technology company at the same time and doing sales calls by himself to sell the solutions. Too much. How do you manage your process within your cardiology practice while also trying to be the IT person? It just doesn't match, right? And guess what? If you find the right person to handle that, that will energize you, but also energize that person because that's what they light up to do. There are people who enjoy the deep dives, how to optimize staffing workflows, bill correctly, how to find new revenue opportunities with your existing billing. You want to hire those people so you can focus on what gives you energy. If it gives you energy to do some of those tasks, absolutely take that on. But burnout really is about your feelings. If it's something that you dread doing, if you push off, then that's a sign to you that maybe you don't need to do it. And we've seen it time and time again. A great book, The Who, Not the How, by Dan Sullivan and Dr. Benjamin Hardy is a great book to read to give you up to speed on how you can start to level off, how you can delegate some of these tasks that don't give you energy so that you can do what you do best. And that will help you avoid burnout. If you don't want to suffer from burnout, number one, look inside to understand what's driving you, giving you energy, and do more of those tasks. Number two, the tasks that don't give you energy, that don't get you excited, you find yourself procrastinating on, you want to find a who that can take that on, because that who will be someone that gets excited about those tasks that you don't get excited for. It almost becomes like a perfect puzzle. 3, you have to trust the process, that this person will do what they need to do, and you don't dip back into that, because that would provide excuses to do the job and then ultimately get back into that burnout state. So that's how we've seen a lot of practices avoid burnout. Let's go into the next question. One of the things that we hear all the time is doctors have all these great ideas, or medical practice owners, and they want to start something, but they just don't have the resources right now to start these new projects. And it can take years, even decades, before they get into it. And ultimately, some of them just give up and they just sell their practices before they even start. We see this time and time again. One of the things that we've seen with a lot of medical practice owners is that they may want to acquire more practices. Let's say, for instance, you're a specialist and you may want to bring in primary care practices to kind of help augment your specialty. Or let's say you want to get into clinical studies. But the challenge is you just don't have the cycles in the day to see patients, run your practice, and start new projects. So how do you handle that? One of the things that we've seen is that medical practice owners need to delegate. They need to understand exactly what are their priorities and then delegate. There's a saying that says, if you do everything, you do nothing. If you have to focus in on something, what we try to do is have quarterly goals, some cases weekly and monthly goals. And in those weekly, monthly, and quarterly goals, we had no more than 3 things we're trying to accomplish at one time. Yes, there's other things I want to do. I want to one day play the guitar. I personally want to one day get better at golf. But right now, I am focused on building my brand for this quarter. I am focused on helping my clients for this quarter. What you want to do is prioritize. Once you kind of have a priority list, then that can help alleviate some of the pain of the new projects. Not saying you will never get to it, but if you put that into a process that you say, okay, Q1, I'm focused on fixing my billing. Q2, I'm focused on hiring the right person to be my practice admin or chief operating officer, so I don't have to deal with that. And then month 3, I'm looking to get into this new area. So as you can see, it's a stepping stone. It's a progress. So the first thing is to have a priority list. And that priority list, just like anything, it's a goal, right? We've heard these goals over and over again. How you create them, you want to have goals that are measurable, actionable, that have time limits to it. Definitely agree to all that. You want to follow that process. But for me, it's really more about, what excites you at this moment and focus on that one thing. Right now, if it excites you at this moment to really unpack your billing and making sure you're getting properly reimbursed, then do that. Focus on that. And give yourself, let's say 30 days. By the end of this month, I will have all the billing understood and bring the right people in. And then when you know you're finished is when you felt like it can be packaged up and then it can be run by someone else, because you have a sense of how that should work. And then now you can move on to the next task that gives you excitement. But what you can also do, if there's something that's really exciting about it, but you feel like you're just not there yet, put it on your plan of action for the year. And maybe get to it in Q4, the end of the year. But at least it's there as a treat, if you will, for that really exciting project. You feel like, I want to get to that, but I may not have the processes in place to get there yet. So that should help you prepare for those new projects and plans that you have for the future, because ultimately it's about what you need to get to the future, and getting excited about that. You want to let your energy guide you in that path, because that will get you to the next level. If you feel like you don't have the impetus to get to the next level, number 1, you want to prioritize, making sure you focus on what you can do. At most, you can only do 3 projects at a time. Number 2, if there is something that excites you, go ahead and put it on your calendar over the next year. So at least it's on the list somewhere so that you know you eventually will get to it. Number 3, you want to have measurable goals, time bound, whether that's daily, weekly, or monthly, or quarterly. You want to make sure you write them down and you stick to it and focus on that. And finally, number 4, once you finish that initial project, you want to make sure you have someone available, like your practice admin or your operating officer, that can take that to the next level and optimize it, so you can move on to the next project and you can continue doing more and more exciting projects for the future. If you like this content, follow me for more, but check out other content that I have about growing medical practices, building your business for the future, understanding new technologies like AI, all this on this channel. So definitely go check it out.